Health insurance buyers are increasingly asking AI platforms to compare plans, explain provider networks, summarize costs, and recommend options before they visit a carrier website. That changes the competitive battlefield. The benchmark shows that being mentioned in an AI response and being recommended on an AI-generated shortlist are very different outcomes. Hey, I'm Mark Huntley, founder and CEO of CiteWorks Studio. At CiteWorks Studio, we study how brands show up across Google, AI answers, and the public sources buyers trust before making decisions, and how that visibility turns into credible citations, comparisons, and recommendations. The report studied the health insurance market across ChatGPT, Copilot, Gemini, Google AI Mode, Google AI Overviews, and Perplexity. It analyzed 1,583 observations across discovery and evaluation prompts, provider comparison prompts, and pricing and cost research prompts. The shift is especially important in health insurance because buyers are sensitive to trust, network access, regulatory standing, complaint history, and third-party validation. AI systems synthesize those signals from the public evidence layer. That means carrier advertising and brand awareness are only part of the picture. The sources AI can retrieve, understand, and cite now influence which carriers appear credible enough to recommend. The benchmark shows Kaiser Permanente as the clear recommendation stage leader. It earned 52.9% valid recommendation coverage, an average rank of 1.4, and a rank 1 rate of 40.7%. Its net sentiment score was 0.916, the highest among measured carriers. Blue Cross Blue Shield was the strongest challenger with 37.1% valid recommendation coverage and an average rank of 1.9. The analysis found especially strong performance on Copilot, where Blue Cross Blue Shield reached 79.1% recommendation coverage, and on Perplexity, where it achieved a 29.4% top 3 rate. The likely strategic lesson is source density. Blue Cross Blue Shield's federation structure appears to create local and national content across multiple layers, which may help AI systems build more confident recommendations. The most important health insurance insight is the visibility to recommendation gap. UnitedHealthcare appeared in 72.0% of observations, the highest raw presence in the dataset, but its valid recommendation coverage was 28.1%, and its rank 1 rate was only 4.7%. Aetna and Cigna show a similar pattern. Aetna appeared in 57.0% of observations, but earned 25.2% valid recommendation coverage. Cigna appeared in 37.3% of observations, but earned 11.5% valid recommendation coverage. These are not awareness problems. They are recommendation conversion problems. AI systems may mention a brand because it is large, familiar, or relevant, while still withholding shortlist credit because the public evidence layer does not support a strong, positive recommendation. The benchmark also highlights structural invisibility. Elevance Anthem appeared in only 1.9% of observations and earned a valid recommendation coverage rate of 0.07%. The benchmark recorded 0 top 3 placements and 0 rank 1 placements across all measured platforms and clusters. That is significant because Elevance Anthem is one of the largest health insurers in the United States by membership. The analysis suggests that naming complexity, sub-brands, regional affiliates, and thin entity recognition can suppress AI presence even when underlying market position is strong. Platform behavior also varied. Copilot showed the highest recommendation concentration. Perplexity was more distributed, with UnitedHealthcare and Humana performing relatively better than on other platforms. ChatGPT and Gemini showed the strongest Kaiser Permanente dominance. For leaders, this means prompt level and platform level monitoring matters. A single aggregate visibility score can hide where the real risk sits. The source ecosystem is the strategic layer. The benchmark points to official carrier and plan content, provider network directories, employer enrollment guides, consumer review platforms, comparison articles, editorial reviews, regulatory sources, community discussions, and local or regional content. These sources shape how AI systems frame health insurance carriers. Positive reviews, clear plan documentation, regulatory credibility, comparison coverage, and locally relevant content can all support stronger recommendation stage visibility. Citation frequency alone is not endorsement. A carrier can appear in informational or neutral context without becoming a recommended choice. The goal is to strengthen the citation architecture that supports favorable shortlist quality framing across high-intent buyer prompts. The leadership takeaway is clear. Health insurance brands need to manage AI search visibility at the recommendation stage, not only at the mention stage. The benchmark estimated total modeled monthly AI opportunity value across the measured category at $41.7 million, with Kaiser Permanente capturing 7.4%. These are modeled benchmark estimates, not revenue figures. For CEOs, CMOs, and growth leaders, the practical move is to identify where your brand is visible, where it is recommended, where competitors are preferred, and which sources are shaping the answer. In health insurance, the next competitive advantage may come from building the public evidence layer that makes your brand easier for AI systems to trust, cite, compare, and recommend.